Now to more stories. In Zimbabwe now, the Health and Childcare Minister Douglas Mombeshora says the government has declared a severe shortage of medicine and drugs in public hospitals, leaving patients reliant on private health facilities. Douglas, who made these statements during a recent pre-budget seminar in Parliament, described the unavailability of medicine as distressing, emphasizing that the country is experiencing a significant crisis, particularly at lower-level healthcare facilities. He pointed out that the Ministry of Health requested a budget of $129 million for 2023, but Treasury reduced the budget to $52 million, creating a significant gap. Mombeshora appealed to Treasury to fulfill the ministry's requirements, indicating that they require approximately $17 million worth of medicine every month. Now, joining me to discuss this is Tawanda Benjamin Watadza, the Treasurer General, University of Zimbabwe, ZINASU. Thank you so much, Tawanda, for joining us on the news. Tawanda, can you please confirm you can hear us? I think your device is muted. Could you please unmute and confirm you can hear us?
Oh, yes, I can hear you.
All right, thanks for joining us once again. Now, Tawanda, how would you say that the shortage of medicine has impacted the quality of healthcare that is provided in public hospitals in Zimbabwe?
Thank you very much for that very important question. In Zimbabwe, we are facing, according to what we have witnessed and heard during the pre-budget seminar in Parliament last week, the statement from the Minister of Health and Childcare, Dr. Douglas Mombeshora, when he articulated about the state of the healthcare in our country, shortage of medicines, basic medicines, essential medicines in our country. This has impacted the people of Zimbabwe in a way that in children, we find that about 1 in every 11 children every year, they die because of a lack of simple, preventable diseases that they are facing in country because of lack of proper healthcare sector. And also in women, pregnant women, about 3,500 women each year, they die because of lack of, because of the health sector, the poor health sector that we have in our country. Because we find that in the capital city where I am in now, about we have only one maternity theater at the biggest hospital that is working, and that was built by the colonial government, and it's also another how it is impacting the people of Zimbabwe. And we also find that in rural areas where they in rural areas, the people they have to travel long distances to have these medications, and we find that even in public hospital we cannot find a simple medication like paracetamol, painkillers. You can't find them in the hospitals, and this is caused by, I think, lack of what the minister said, as we've alluded to earlier. I think this is a brief of how it is impacting the livelihoods of our people, and a number of people are being affected by this.
Right. Tawanda, now, how would you say that patients have been affected by the reliance on private health facilities?
Sorry, come again.
How would you say that the patients have been affected by the reliance on private health facilities?
All right. So in Zimbabwe, the public health system is the largest healthcare service provider. So in our country, we find that this public health system, it does not have enough medication to cater for the people of Zimbabwe. Hence, the people, even when they go to public hospitals, they are referred to a private sector. The medications they are very expensive, because we sort of have like having a capitalist economy whereby each individual who owns his or her pharmacy puts a price that he wants on medication, and therefore it affects the number of people that they don't have maybe enough money to purchase those medications. Therefore, the private health sector is impacting the livelihoods of individuals to a great extent, so that they fail to have or to access medication. The affordability is not there.
All right, Tawanda Benjamin Watadza, thank you so much for joining us on the news.